Dr. Linda Park here. Today I'm going to show you the effect of tongue position on airway. So I've talked about tongue position and the importance of that to the airway and many other things, but I'm going to show you something that is quite fascinating. We now have at our office something called a CBCT. It's a 3D x-ray of basically the skull and the neck area. So I'm going to show you some things on that, but it's CBCT, and it stands for Cone Beam Computed Tomography, and it's minimal radiation to give you maximal information. It's really exciting. So this is me, just so you know, and what you can see is, if you're standing on top of my head and looking down, this is the size of my airway, which that looks like kind of a garden hose kind of airway. That's the airway that we should all have to breathe through for optimal health. So something else to notice, here's a side view of it. There's the size of my airway. This is my tongue on the roof of my mouth. You say, well, where is the tongue? Where's the roof of my mouth? Exactly. They're one. So the tongue is all the way up here on my palate. When that happens, it brings this whole part of my tongue out of my throat, and that's how I can breathe well with my nose and get oxygen down to my lungs. So here is, you can measure it, and they don't say that this is definitive data for size, but it is helpful as an example to see what I'm talking about. So total volume is 19.3 cc's. So I'm going to bring up another person to show you the difference between tongue on the roof of the mouth and tongue not on the roof of the mouth. So here's another patient. This is actually a child, and what you can see is her tongue is not on the roof of her mouth. Can you see the space there, the air that's between the palate and the tongue? And look at the difference in airway size between this patient whose tongue is not up. Can you see how it's red? So her total volume is 4.1, mine is 19 point something. So that's the difference in tongue position. Then I'm going to show you one other person that it doesn't matter for her if her tongue is on the roof of her mouth or on the floor of her mouth. She has some other issues going on, and that's swelling of tonsils and adenoids. And this patient, even though her tongue is on the roof of her mouth, you look at that and you say, well, wait a minute, I don't see an airway. Exactly. She's using a CPAP at night, but it's not helping at all because she has swollen adenoids and swollen tonsils blocking off her airway. So she has, you can see the calculation, total volume 3 cc's. Compared to 19 cc's. So do you think she has any health issues? She does have a few health issues, because when you can't breathe properly, it causes inflammation in the body. Inflammation can cause diabetes, heart disease, stroke, cancer, on the list goes. So this person, this is when CPAP is vitally important. Then we also think about other things. Could orthodontics help to widen the palate? Could correct tongue posture help? In her case, no. But in this child, the case of the child, where we have her tongue, she's actually in ortho right now, having her palate widened, and we're training myofunctionally correct tongue posture so we can make her airway bigger and help her sleep better at night, help her develop better as a child, help her think more clearly and breathe more clearly and have a healthier life. So that's the benefit of this sort of imaging that gives us all kinds of information for a healthy airway and a healthy life. Thanks for watching. Hope you found it helpful. If you did, like, subscribe, and stay tuned for more great content.